Good day, everyone. Welcome to the CSI Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. In today's episode, we have a topic, the so-called static glabellar lines. Before our discussion on that, let's all welcome Ma'am Maureen Bautista.
Hello.
Good
morning.
Yay. So, our concern actually, and us who are in the age of 40s, mid-40s, late 40s, okay, will be those lines and wrinkles, okay? We start to notice them on the upper third of the face, okay? And the most common one is the one in the glabella area or between the eyebrows, okay? Or we call them frown lines, we call them tiger lines, lion lines, angry lines, okay? Some would say uno, some would say 11, or 111, 1111, or
7-Eleven.
7-Eleven, or barcodes. Or there are also even other patterns of these glabellar lines. I've seen those with U pattern, phi pattern, I pattern, X pattern, and other patterns. Or the V, Voltes 5 pattern. So this area here, okay, actually we have muscles there. And those muscles, we use them, of course, facial expression. When you're angry, you frown, okay? When you're, exactly, the emotions. When you're critical, you're a critic, you kind of frown, okay? Or those who are working in some kinds of a job that would need like frowning or whatever, or like you're an actor or actress, you frown.
When I sing.
When she sings, okay. So looking at the upper third of Ma'am Maureen, okay? So we've noticed already this line here. Actually, a month ago, she had a toxin injection, okay? And then right now, I'm assessing the glabellar line, okay? I noticed that there is still an etched line. Did you notice that too? Okay. So there's a difference between the so-called dynamic line and static line. So what you have is the so-called static line. When you see dynamic line, these are the lines that are found when you move the muscles, when you contract the muscles, when you do your expression, or like a dynamic movement or an animation. So you move those so-called procerus and corrugator muscles, okay? So dynamic wrinkles, you see them when you move the muscle. Now, the static wrinkle or static line, without movement or just at rest, you see them already, okay? So she has also the static line. And the static line you have as to the grading or scaling, we call it the mild static glabellar line. Yes. So we have the mild, moderate, severe, very severe. We grade them as to 1, 2, 3, 4. Okay? So when we have these so-called dynamic wrinkles, we treat them primarily with the so-called injections of botulinum toxin or your neurotoxin or neuromodulator. Because those kinds of botulinum toxins, they work on the muscle. So what they will do, of course, they will tell the muscle not to contract. So no more dynamic wrinkle. What about static wrinkle? So it's something already etched in the skin. Nandun na kasi siya.
So how do you address it, Doctor?
Well, it's a different kind of a treatment. It's not Botox. You notice, even if you had the Botox injection a month ago, you still see an etched line there. Kasi what's happening with these kinds of like movement of the muscles, okay? So you're pulling the skin inwards. Diba? You're contracting the muscle. Then the skin is being pulled inwards. If you always do that, you always contract repeatedly, okay? Ulit-ulit. So what's happening is the skin nagiging dented. So like in the skin layer, there are some collagen fibers. They're being broken down or they're torn, napupunit. So sa constant na muscle contraction,
like permanent
repeated,
engrave, no?
Yon. So it became permanent. That's why we always recommend, huwag ka masyadong magalit. Don't always like frown because the skin will get dented all the time. So you're tearing.
Pwede bang magalit na nakatawa?
Joy! So you're tearing some of those fibers in your skin dermis. And skin dermis is made up of those fibrous connective tissue. So you're tearing elastin, you're tearing collagen and other fibrous connective tissue matrix proteins. And apart from that, apart from repetitive movements, will be aging. Okay. Aging is a phenomenon that, of course, it happens to all of us. So
Yes.
as we age, there's what we call volume loss, atrophy of the tissues, the skin
Inevitable.
tissues, and also the collagen, the elastin, glycosaminoglycans, they all like get depleted, or they degrade over the time, or they degenerate over the time. So aging is also a factor, okay? Apart from the constant frowning actions of that muscle. So now, going back to the question, how do you manage it? Of course, the skin is already like dented, right? There's a depression there already. So how do we treat it? We have to use a material that will push the skin upward. So now, what we do is we inject a so-called substance in the form of hyaluronic filler.
Hyaluronic.
Yes.
Filler.
So these are dermal filler. Now, hyaluronic is found in our skin, in our connective tissues, in our body. So it's a natural substance. Hyaluronic is a glycosaminoglycan. It's an amino polysaccharide that attracts water, and it's responsible for the skin turgor plus hydration of our skin tissues. So hyaluronic, we place it in that static line, in that dented line. So once you inject it there beneath that depression, it's gonna elevate the skin surface, making it even on the top layer of the skin. Plus, it will also hydrate the skin, radiate the skin, and restore that good skin integrity. Yung mga nawala, nire-replace mo lang. Okay? So, it will help in volume restoration. It will also help hydrate the skin tissue. And at the same time, it has a percentage that it will stimulate collagen formation.
Nice. So it's safe, Doc, right?
It's very safe once it's done by our authorized aesthetic injectors. Okay? Because the thing is, with our anatomy, we have arteries on the sides, on this medial, like the sides of that onse, okay? Or
scary,
beneath the onse, the so-called onse. So we have anatomical, what do you call that?
So Doc, if they're not
consideration,
aware of
the arteries, the blood vessels can cause devastating complications, skin necrosis, tissue necrosis, and the worst will be blindness. Okay? Because I have patients coming to me, Doc, I heard filler can cause blindness. And filler itself does not cause the blindness.
Okay.
What can cause the blindness will be the accidental injection of the filler into an artery that's connected to the artery inside your eye. There you go. Because the filler, once you inject it into an artery that connects to the eye artery, the filler will kind of like flow towards the inside of the eye and block the supply of blood in your eye, causing blindness.
That's why when they're not professionally knowledgeable about that thingy,
exactly.
Oh my, please don't.
Right. So there were already global reports of blindness because of the incorrect injection technique. Okay, and of course some are not doctors doing this. Okay, and the glabella area is the #1 anatomical area for the severe complications all over the world, okay? So it should only be done by doctors who are trained in this field, by medical practitioners who are trained in this field, okay? There you go. So, hopefully you've learned something. Let's do the procedure when CSA Medical Aesthetics returns. We are now about to perform the correction of the glabellar static line, okay? Before doing the injection, okay, we have to do some anatomy review here, okay? So a while ago, we were discussing on the type of dynamic and static lines and what is the difference, what is the primary treatment, and then some assessment there. And of course, we also included the cause of those kinds of lines, okay? For now, a bit of an anatomy review, okay? In this area, since we have the so-called in terms of the muscles, okay? So we have here the center muscle, here the procerus. And then on the sides are your corrugator muscles. So these are the ones we treat with our neurotoxin or botulinum toxin, okay? And then the important thing that we have to master, okay, there you go, master, when we do filler injections will be the blood supply in the area, okay? So we physicians, we are avoiding the so-called blood vessels in the eyebrow area, medial aspect, the medial supraorbital aspect here. So we palpate for this is the supraorbital foramen. So this is where your supraorbital artery and vein comes out, okay? And supraorbital nerve comes up. And then medial to that, or 1 cm, we have your supratrochlear, okay? So these are blood vessels that are danger zones, danger areas. Same thing on the other side. So for our doctors doing this, performing this, you have to do your marking supraorbital and supratrochlear. So these kinds of vessels are also like they're branches of your internal carotid artery, and they connect with the ophthalmic artery. They connect with the artery in the eye. Okay, so these are like danger zones, X zones.
No.
So for filler injections, okay? Now, of course, we doctors, we know the anatomical tissue layers, and the layer that these vessels are located, they're in the deepest layer from the bone. So when we do filler injection, we go at the superficial layer in the deep dermis or the subcutaneous layer. We call it the layer 2. Okay, so we have to stay in the right anatomical layer. So what we'll be doing right now is injection of our dermal filler just in the area of the edge line. Okay, so white marker again, please. So we have the edge line here. So I just move the tissues here medially like that. So this is the first mark. So this is the severe one, and the second one is this. Okay, so we don't want to touch the one with the artery here, the one with the artery there. Okay, now in doing filler injections, we either use needle or cannula. You can use needle, you can use cannula. Okay, if you wanna, actually there are other cases that we do filler injections in this aspect here when they have a sunken inferior forehead. We use cannula method because we have these blood vessels here. So on the periphery inferior aspect of your forehead, if you have a volume loss, you can use the cannula method there. Okay, Ma'am Maureen? Yes. A little bit of an anatomy, a little bit review there. And right now, so we'll do the procedure. Okay, before any treatment, you have to cleanse the area. And of course, it's important to follow aseptic technique, disinfect the skin. And then actually a while ago, there was a topical numbing cream, which you can leave about 30 minutes. And I also have another anesthesia, which is the so-called cryogenic spray, okay, the so-called pain freeze. So I do this also with my patients who are like not willing to wait 30 minutes for the lidocaine topical cream, the numbing cream. So we have the so-called pain freeze, okay. So I have my nurse spray it in the area. Okay, there you go. So we spray it, give time for the so-called frosting. Okay, there you go. And then we can inject our dermal filler. So the filler that you need to use here will be the so-called low molecular weight type of a filler or small particle size. You cannot inject a high G prime type of a filler in the glabellar section. You only use a low G prime, a low viscosity, and small particle size or low molecular weight only. So what I do is I use like a gauge 30 needle, since I have like a thin filler type here because we have a thin tissue here. So I'll start with the left aspect there, okay? So the inferior line there, okay, just superficial layer 2. I still do some aspiration, okay? It's just my habit, okay? Although it's not necessary. Again, fill in this part here, just a minimal amount, no need to overfill. You can use like 0.1 in this area here, okay? Just push the product. And then after that, we can also inject at the superior aspect of the line. There you go. Since she had a neurotoxin a month ago, so we can actually do a minimal touch-up of the neurotoxin. Okay. So I have my pain freeze for like a numbing. So it's just a cryogen spray. Okay, close eyes and then spray on the area that you will inject. There you go. So I'll just treat this one here, just the last one. So usually I only like use 0.2, 0.3 of my product in this area since we only have a mild static line, a grade 1 problem. So that will be enough. Okay, there you go, it's done. Now the filler attracts water 10,000 times. So we still give time for the filler to expand. So it will further stretch the skin, it will further elevate that indentation or that depression, and it will improve the skin integrity as well. And my final touch will be your toxin injection. So I have here my neurotoxin. I'll be injecting the procerus muscle here, okay. Intramuscular injection, you can start with 2 units here and then your left corrugator here, the belly of the left corrugator. So you can also give your 2 units there. Then usually the neurotoxin works in about 8 to 14 days. You'll gradually see that the lines are decreasing starting day 3. And then we can also inject the tail of the corrugator. In the tail of the corrugator, we go superficial, while in the belly of the corrugator, we go deep, or we go into the belly of the muscle. Okay, there you go. We're actually done with the combination dermal filler for the treatment of static and also the neurotoxin for the treatment of dynamic wrinkle. We'll show the result to Ma'am Maureen when CSA Medical Aesthetics return. And we're back, so we're about to show the result to Ma'am Maureen, and here's our mirror. So there you go. So we did the glabellar lines, those 2 vertical lines brought about by the corrugator muscles, and also reality, the aging process. Okay, so the loss of collagen or depletion of those elastin glycosaminoglycans, because over time, as we age, we start to get depleted with all the extracellular tissue matrix proteins inside our dermis, inside our skin. And of course, with the constant facial movement or those contraction of the muscles during facial expressions, they tend to kind of have this dent, and it becomes permanent or static already, the static glabellar lines. Okay, so how was it, Ma'am Maureen?
There's I'm more relaxed actually, but there's still a bite.
Yes.
There's a bite, right? Just a bit.
Yeah.
It's not even as painful as ant bite.
Yeah.
So it's even lesser. So
Correct.
don't worry about that for those who are really scared. So it's just like, once she starts inserting, you won't feel anything anymore.
Yep. Exactly.
I think that's very quick. The spray.
Yeah. It helps.
We used to have the cream, right?
Right. So we also have the pain freeze. Actually, even when I have an injection and I'm not into waiting for numbing cream to take effect, I just spray the area which I will inject. I do my own toxin injections, and the numbing is in seconds only. That's why we have to inject right away. So that helps also to decrease any anxiety about the pain. Okay. Then we use a gauge 30 needle. So that is also like a needle that's super tiny and less of the sensation of the needle injection. So it's like a very tiny minimal prick, but it's tolerable, okay? Very tolerable. Plus with the toxin injection, we also use a gauge 30 for the tiniest needle, 4mm needle only. That's why actually I could say that one is painless, super painless, because we have right now with us those very, very tiny needle, gauge 34, 4mm only, and just in the right depth, just in the right muscle tissue layer.
Wow.
Okay. So far so good.
Wow.
So again, for treatment of static lines, okay, it's not just the toxin injection, because I just want to explain to our viewers that we have 2 types of lines or wrinkles, the dynamic and the static, okay? So the dynamic wrinkle is treated by the toxin. You see the dynamic wrinkle when you move the muscle. The static wrinkle, it is seen at rest, so without moving the muscle. So it's already etched in your skin, and it's treated by, at first we start with the filler. But for cases that have very severe glabellar static lines, are very deep, or it's a furrow already, it's a groove already, it's a fold already, not only filler, but we still combine with some PDO threads to help with that skin scar already. So if you have the etched line, it's already a scar in the skin. So we also combine with PDO threads, or we also combine with the fractional CO2 lasers or your RF microneedling, just to improve the skin surface, to get rid of that linear scar. Because I was looking also at Maureen's skin. Actually, I still see minimal, like an etched line there. Or some will have this on the glabella skin. They have like enlarged pores. It's also good to use other devices, like for example, if you have your LaserMD, thulium fractional lasers, or even we have the MDF of the Hollywood Spectra, we can treat them. So it's already a combination treatment for those who have the severe glabellar static permanent fixed lines. Okay, so they're different from the dynamic wrinkle. So the permanent wrinkle will have a different treatment or multiple treatments. Okay, because the damage is in the skin already. So may napunit na kasi sa skin sa kaka-frown. Okay, unlike when you have dynamic pa lang, treat it right away with your neurotoxin. And then, you can prevent those permanent static lines.
Actually, that was my mistake. It took a while kasi, we're all busy, we're moms, we're working, we have family, then all the travels that you have. Tapos, lumala.
Yeah.
So, it got severe, and now I noticed the dent, it got elevated. So,
Right
I'm
now,
happy.
That's a good thing with dermal filler. It gives an instant elevation. Dermal filler are like instant volumization, and eventually it will help in collagen restoration. Okay, there you go. So I hope you've learned something new today.
Thank you, Doctora.
Okay, thank you so much, Ma'am
Thank
Mau.
you.
Any message to the viewers?
If I were you, I think, what's the best age?
Best age?
30, probably the 30.
Yeah,
there
30s.
are 30s who are starting.
Yeah.
Mine, I think we started when we were 40. I noticed, but then we take it for granted.
Right.
I think she was suggesting, once you see it, it's not being, like vain. I think sometimes they mistaken being vain from, just delaying the aging process.
Right, yeah.
Probably you should take action now before it's too late.
Amen. The earlier you start, the better. Actually, we even had cases of younger people, like a 19-year-old male with a deep forehead wrinkle already. So there are cases what we call like an inherited one, okay, or like a predisposed to this kind of lines or wrinkles. So not only like 30s, 40s, 50s and above, we also had cases of like in their teenage years, would you believe? And mid-20s. Aging starts at 25 right now.
Oh my.
Oh my. Okay. There you go.
Because of environmental factors.
Environmental factors, several factors, the
lifestyle.
the lifestyle of the generation right now.
Yeah.
Okay. So thank you so much, Mama. Do you have any like Instagram or anything social media that they can like ask you, Mau, masakit ba?
Yeah, you can just message. Can I mention my salon here?
Yeah.
Heart Salon.
Yeah.
I'm a makeup artist and I'm also a part-time voice coach and also a hairstylist.
Yes. She's taking care of my hair. Thanks to her. Yeah. You visit her. Let's visit her in her salon.
We'll see soon about to have her highlights.
Yes. Okay, thank you so much. So if you have any questions, you may email us at csaskinclinic@yahoo.com, our FB page, CSA Medical Aesthetics, Instagram, CSA Medical Aesthetics. Our clinic is located here at the Infinity Shop, Pulong Maragul, Angeles City. Contact numbers 0933-860-9193 or 0917-504-4268. Baka pwede silang pa-schedule ng makeup or hair.
Meron just contact us na 0917 546-3131. Bigla ko nakalimutan. Pero direct message na lang sa Instagram ko, Maureen Bautista or Diva at diva.com. And then at the same time, pwede din sa aking TikTok, but I don't really use.
So,
Facebook na lang, pwede din.
Right. So, I'm scheduled for my highlights.
Yes.
Siya po ang bahala sa akin. Hair and makeup. Siya rin po ang sa makeup. Okay? So, thank you so much. God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.